commission was set up to look inside Walter Reed, as well as to try and carry out a nationwide review of the care that's given to our returning soldiers. And former Senator Bob Dole and former Secretary of Health and Human Services Donna Shalala were the co-chairs of this commission, and they are now this week reporting their findings. They join me now from Washington, D.C. Senator Dole, Secretary Shalala, thanks for being a part of the program.
Thank you.
Senator Dole, let me begin with you. Does your committee conclude that it's not so much the care at Walter Reed, we can see that that is good, but the problem has been that some of the soldiers who need that care weren't always able to get it in a timely fashion?
I don't think it's so much, most of the reports are the care was excellent. The Walter Reed problem was a facility problem, but it also impacted outpatient care. But the acute care cases, like the young man you had on, the amputee, you know, their care is very good. It's when they get to the outpatient status, when you start having problems with appointments and, you know, how long you have, what they call medical holds, how long you stay in the hospital. Problems that have been around, I might say, in every conflict we've had over the last 50, 60 years, but we want to make it better. So Secretary Shalala and I are honored to chair this commission, which makes 6 positive recommendations that, in our view, will be very helpful to families and soldiers who suffered serious injuries.
I want to share those in just one moment, but Secretary Shalala, let me just ask you, for starters, after you were able to take a look around at Walter Reed, were you satisfied with the conditions of the physical property there?
Well, I didn't make a judgment about the physical property. As a matter of fact, the Secretary of Defense has already made some corrections from what was reported in the Washington Post. What we did look at across the country is whether this system can be more patient-centered, whether it can be focused on being more supportive of patients and their families as opposed to the institutions. And that's where our recommendations come up, that we need better interface between the two agencies. Their records, soldiers complain they have to keep redoing their records. Someone loses their records. That can clearly be fixed. But more than anything else, understanding the system, having someone be their advocate, coordinating their care, making sure we're making the investments in their future in terms of education and benefits that we ought to be making.
I understand.
We've made 6 recommendations.
Let's look at them, Secretary Shalala,
okay.
And I'm glad you mentioned those because we want to put those on the screen and then I want to get you to comment on them. So
okay.
Here they are: to create recovery plans, a restrictive disability compensation system, aggressively to treat post-traumatic stress disorder and traumatic brain injuries, strengthen family support, transfer information faster, and support Walter Reed through 2011. And Secretary Shalala, you were just saying that these recommendations are very, very important here.
They are, and most of them can be done without new legislation and without new money being put into the system. They're doable, they can be done within the year, and it's important that we step forward and say, we can make major improvements. We clearly have the power to do that, and we ought to do it now.
Senator Dole, one of the recommendations, basically, you would like to transfer the disability rating and take that away from the Pentagon and have the Department of Veterans Affairs basically handle and decide when the benefits that a soldier should receive rather than having the Pentagon do it. That's right, isn't it?
Yeah, and I don't think the DOD was ever suited for that. I mean, I think they ought to make a finding if you're unfit for duty, then it ought to go to the VA. There ought to be a physical that the VA and the DOD work out, be one physical, and then that person is rated by the VA. And in addition to the disability rating, as part of the disability rating, there's going to be a quality life component, which hasn't been the case. Let's say on a scale of 10, your quality of life is reduced to maybe 3 or 4. You're going to be compensated for that. And the DOD, though, will still be involved. If you've got 10 or 15 years in the service, you're going to get paid for that service by the DOD.
Well, we're just about out of time. It's on the President's desk. Very quickly, are you hopeful that he'll act on this and not ignore it?
We expect him to act on it. We've been in touch with the White House yesterday and today. The President looked us straight in the eye and said that if we came up with good recommendations, he would make sure they were implemented. I take him at his word, and I think the American people have said clearly, whether or not you like this war or not, we send young people into harm's way. They come back injured. They ought to get first-class care and a first-class investment in their future.
We'll leave it right there. Secretary Shalala.
Whatever it costs. Whatever it costs.
Whatever it costs. Senator Dole, Secretary Shalala, thank you very much for your time on this commission and for joining us on the report here tonight. Thank you very much to the both of you. All right. Question is, what do you think about this? What do you think about the quality of the medical care given to our wounded soldiers? Email me your thoughts on this, cn8.tv. Click on the icon for Art Fennell Reports.